Okay, we'll now have a panel discussion of some of the key issues related to the decision to use vaccination as an aid in the control of avian influenza. My name is Jim Roth, and I'm a professor of veterinary microbiology and immunology at the College of Veterinary Medicine at Iowa State University, and the director of the Institute for International Cooperation in Animal Biologics, an OIE Collaborating Center. And I will serve as moderator of the panel. And our panel members will now introduce themselves.
I'm David Swayne. I'm the laboratory director for the U.S. Department of Agriculture's Agricultural Research Service Southeast Poultry Research Laboratory. We're the laboratory for USDA that does research on avian influenza and Newcastle disease.
I'm Chantanee Buranatha. I'm a senior veterinary officer from Bureau of Disease Control and Veterinary Services, Department of Livestock Development, Thailand.
I'm Les Sims. I'm a private veterinary consultant working with the FAO. I've worked predominantly in Asia with experience with outbreaks in Hong Kong from 1997 to 2002 and subsequent experience with other Asian countries since then.
I'm David Suarez. I'm the research leader at the Southeast Poultry Research Laboratory working on avian influenza. We're the USDA laboratory for those exotic diseases of poultry.
I'm Alex Thiermann. I'm the chairman of the Terrestrial Animal Health Code Commission of the World Organization for Animal Health, OIE.
I'm Dennis Senne, poultry specialist with the United States Department of Agriculture's National Veterinary Services Laboratory, who serves as an OIE and FAO reference laboratory for avian influenza and Newcastle disease.
I'm Nikolay Vlasov, head of the Department for Veterinary Surveillance, Russian Federation.
I'm Ilaria Capua. I am head of the OIE and FAO reference laboratory for Newcastle disease and avian influenza in Padova, Italy.
Who's Koch, senior scientist and head of the National Reference Laboratory in the Netherlands at the Central Institute of Animal Disease Control, and I was closely involved in the Dutch outbreak in 2003.
Each of our panelists is an expert on avian influenza. They have given presentations on the current state of science and practice of vaccines, vaccination, surveillance, diagnosis, and control of avian influenza. They also discuss the optimal methods for control and eradication of highly pathogenic avian influenza. We all recognize that controlling avian influenza is an enormous challenge, and the situation is different in each country. In some countries, resources may be limited, and they may not be able to implement the recommended best practices. During this roundtable discussion, we will explore factors that should be considered in controlling avian influenza in conditions of limited or very limited resources. We will start with a scenario of a country that has moderate resources. The scenario is a hypothetical country with about equal commercial and backyard flocks. They have a moderate veterinary infrastructure and moderate resources, but not enough to accomplish all of the recommendations for best practices. They have had outbreaks in some backyard flocks. The flocks are distributed throughout the country and consist of chickens and ducks. The country is located on a major waterfowl migratory pathway. There have not been any human infections to date. The disease is not endemic in neighboring countries. The surveillance system is stressed from the few outbreaks that have occurred. They have some exports, but it is a small percentage of their poultry economy. The industry in the country is urban and rural. The authorities have decided that the goal is to eradicate the virus from the country. And our panel will discuss what is the most important aspect for them to focus their moderate resources on to give them the best chance of eliminating the H5N1 virus from their country.
By starting by the more general, is first identify the necessary players in developing a strategy to deal with this problem. And thereby I think there should be consultation, multi-sectoral, public health, agriculture, and veterinary services, as well as the key players in the private sector. Communication strategies should be developed from the very beginning in order to keep both the public and the industry well informed. But prior to make a decision, I think government officials to take a look, at least as I see, two aspects. One, the issue of public health, although no human cases have been reported, as to how to minimize the chances of human exposure in these rural backyard operations by using culling, depopulation, and possibly vaccination. And the other one, although the industry is not identified as being that large, to prevent or protect the animal production sector is to work with the private sector and to reinforce the biocontainment aspects in order to protect, even if it's not for export, for national production and minimize the economic impact of the disease.
With this scenario, I think we have to look at the source of introduction. And it's not clearly stated here, but it certainly is suggestive of a wild bird introduction, which will certainly play a role in whether we want to consider vaccination or not to vaccinate in this scenario. So certainly if we want to try to vaccinate in this situation, because the virus is not widespread, it is not endemic in the country, certainly targeted vaccination to the high-risk populations would probably be a possible way to vaccinate to help control exposure in this situation. And again, we have to look at the high-risk flocks, those that are likely to have exposure to wild birds. Although, again, not a large commercial poultry industry in this case as far as export, certainly the country will try to preserve their export capability, and that's probably going to be mostly by the use of, again, biosecurity and trying to compartmentalize their poultry industry to separate the industrial poultry from the backyard poultry. And that would probably be a reasonable approach to use, but again, working with their trading partners is going to be very key to get them to buy into that or accept that as a possibility for export. And those are probably the key issues that I would look at to start with.
This is a very interesting scenario and one which I think we need to look at where did this disease come from and how can we define that. Obviously there are some problems with the infrastructure in this country, that they have limited surveillance capacity, but there is plenty of scope available through international support, say the new Emergency Response Centre from FAO, OIE, which would allow a team to come in to actually examine and look at where this virus actually came from and do some proper tracing to work out where this virus is. One of the problems we have is that where you have poor surveillance systems, you don't know whether the outbreaks you are finding are all the outbreaks. And so you need to define that first, because what we've seen in many other countries is people go in, do stamping out, and then find 3 months later that the virus is back in the same location again. So until you can really define where your virus is occurring, you're always going to have trouble. So I think my first two suggestions on this place would be to get some international assistance in very early. That assistance is available. Define the problem better, and then look at ways you can then advance and improve your surveillance system. In the meantime, if you had outbreaks, you would of course try and stamp those out initially, but then look to see whether or not that's really going to be a rational procedure if in fact the virus is more widespread than it appears.
Perhaps rather than focusing their limited resources on vaccinating right away, you're saying they need to focus on surveillance and stamping out.
Yeah.
I agree, Jim, that they should be focusing on stamping out and investigations of these outbreaks. One of the things we need to make sure is, no matter what measure we use, we do it properly, be it vaccination, stamping out, movement controls. If any of these things aren't done properly, then they're not going to achieve the goal you want.
I just want to add to Dr. Sim, because of course for this scenario, they need to the surveillance and find out the source of infection. But before that, before they can seek for international resource, one thing that they can do is to kind of movement control, quarantine that place, and limited movement out and in and out. And another thing that they should do right away is raise public awareness, because it can be bad afterward. But for this case, I think they still have a chance.
It is my impression that at times the situation in the field is not very clear, and in the scenario you say that they have had outbreaks in some backyard flocks, and you assume that they know what they have, which in fact many times it doesn't happen that way. You have an idea of what could be happening. So also when we experienced avian influenza, what we did was we tried to photograph the situation and understand where it was, because unless you know where it is, it's very difficult that you can make any statement or any decision. And another point I wanted to make is this about the source, and the source coming from wild birds. I think that when you photograph the situation, what is important is that you also photograph the contacts that are at risk, because it is, I believe, important that we make a position, we state our position on these poor wild birds that are most probably responsible of introduction in certain occasions, but they certainly are not responsible of every outbreak in a backyard flock that we might have in a developing country, but rather it's the movement of animals or infected materials.
Unfortunately, in this situation, a country which faced with the threat of H5N1 introduction cannot do any simple decision. We cannot say, do this and everything will be okay. Only one thing on which the country have to be focused: to build the logical and working system of the diseases control, not only avian influenza. You have to have good laboratory capacity. You have to have good monitoring and diagnostic system. If you will not have it, you never will have the proper information about the situations that you have. And you cannot plan in the measures. Then you have to build the good disinfection system. Because if you found the outbreak, you have to clean maybe not only settlements or farm, or territory. And only then, if you decide to use vaccination, you have to begin not from choosing a vaccine. You have to begin from working with population. Because if the population will not understand what for and what you will do, you will not have the success. And so on and so on. And in the end, the government can decide, we will use the vaccination. And in this, I agree with David. It has to be targeted vaccination. The source of infection have to be understood. And the vaccination, we have applied the vaccination as little as possible. In any case, I think that commercial farms, which have a good protection measures, have not to be vaccinated.
I think all the points to this time have been very good, and I want to just sort of build on after that initial examination and bringing in of experts and developing a general program. And in that general program, one thing that needs to be considered is you need to take the country and look at it as not a whole country for the control, but if it's scattered outbreaks across the country, you'll have to break it down into smaller segments and work on those as independent units. So in some respects, it's almost a regionalization of the country, or at least compartmentalization. And with the discussion about backyard versus commercial, you're going to have to determine how much of the infections through the surveillance program are going to be in the commercial sector and how much are in the backyard, and where that virus is moving back and forth. There may be suggestions of an introduction initially by wild birds, but that may not be the case for the secondary spread. And so you have to identify that secondary spread mechanisms and then try to stop those. And really, you have to give, in the initial process of eradication, you have to give those quarantines, those surveillance programs and stamping out a good chance to reduce the infection across the country to as low a level as possible. Because vaccination, even if it's considered, is not something you can begin the next day after you make a decision. There are a lot of factors that go into decisions of how to do the vaccination. For example, is there going to be vaccine available? If you don't have it in a vaccine bank available to use, you would have to go to a company and ask for it to be manufactured. And that may take you 3 to 6 months to get the vaccine you need. Then you have to set the logistics to dispense the vaccine, which actually before that you should decide how are you going to use the vaccine, you know, what sectors, all sectors, which regions, what geographic areas. And so those are plans that you have to make while you're doing the other part of a control eradication program. And so the vaccination is going to be sort of a secondary thing that you're going to bring in after you're already underway.
I think this is where the contingency planning is very, very important, and having your triggers for vaccination written into your contingency plan. Now, of course, it's going to be difficult to cover all scenarios, but at least if you've thought through those issues, at least you then may know where you're going to get your vaccine and have these things in place before you come to a crisis. So I see that as very, very important in this situation.
Following Les's comments about asking for help from international organizations like FAO, in OIE, we have a network, we have established a network of laboratories to help support countries that have problems in diagnosing the outbreaks. And there is, in fact, a service which has been recently made available by FAO, and this is a free courier service to send these samples to relevant laboratories in the world. And since many of us this morning in our talks stressed how important it is to keep these viruses under control, to continue characterizing them and looking at them from a genetic and antigenic point of view, I would really like to invite decision makers and people working in the trench with the infection to ask for our help if they need it. And since we are available, not only myself, but there's quite a developed network of laboratories that are willing to help.
And how do they contact the network? Through?
Well, all they have to do is they can go on the OIE or on the FAO website or on the OFFLU website, and they can contact us. There's many ways by which we can be reached, and I have to say that we have already overcome a lot of the problems with customs and with getting these boxes in time to the right places. Certainly we can improve, but I think that there is a general feeling and a consensus that maybe we are not seeing as many viruses as we should. There has been a lot of movement at the beginning of 2006 until before the summer, and now everything has sort of calmed down. We all think that there are a lot of viruses that are circulating, and I think that we unanimously believe that we should look at these viruses.
Yeah, I want to add to what has been said, that in my feeling, movement control is something that you can do with limited resources and should be done immediately, because you would try to get the standstill of and preventing the spread of the outbreak. If you have a limited laboratory resources, capacity and resources, to get the picture where the virus is, you do not need to sample each farm, but you could get advice from epidemiologists, from statisticians, to get the right sampling, to have, with a limited number of samples, to get that picture. So I would stress to use that.
Before this scenario occur, of course, like Dr. Sim already said, they should have contingency plan before. And I want to add that there should be, some kind of surveillance before. This country export, so it's easily to be done at the slaughterhouse. Just take some samples from the slaughterhouse, which is, if they export, they have to check it anyway, and it just doesn't add any more costs to them, and which is better. Then once the outbreak occur, you don't at least you know, like, kind of the size of the problem, or this is really emerging, or something that found before.
I think in trying to, in a country as described in the scenario, to take advantage of resources available outside of the country, one could do in parallel, one, the actions that have been described as to the short term, getting a picture as to where it is and the extent of the problem. But as it has been described, being in backyard flocks and with a country with poor infrastructure, it is likely that we may not have a very good idea as to the real situation, and therefore this is going to be a program for a long term. It's not going to be easily resolved in the short term. Therefore, I would suggest that in parallel to the action just described, that the country request the assessment of the infrastructure. The OIE has developed a tool that we use in order to have a harmonized approach to know an overall assessment of the infrastructure within a period of 2 weeks with outside experts, and have a better picture as to where the gaps are, where the weak points are, and to develop a prioritized action plan as to how to strengthen those, whether it's laboratory capability, whether it's field surveillance, et cetera, to mobilize the resources, hopefully donor resources coming in, to put the money in the places that will have the biggest impact in strengthening the detection and reaction capability of the country for the long term.
I think in this scenario where you have perhaps scattered outbreaks in backyard flocks, kind of building a little bit on what Dr. Sim said a few minutes ago, it's really important to know where the infection is. And to do that, you have to, I think, first of all, establish a case definition. I mean, what is considered a positive case? If you're not using vaccination, you can use, to your advantage, a clinical disease, with perhaps the exception of the domestic duck, which sometimes can be a silent carrier of these highly pathogenic viruses. But you have to consider that in most countries, backyard flocks have relatively poor husbandry, poor vaccination practices, and you have to be able to make sure that the mortalities that you're seeing in that flock are due to highly pathogenic influenza and not Newcastle disease or some other disease. So by establishing a case definition that you have to have clinical disease perhaps and at least one type of diagnostic assay that's positive for influenza virus might give you enough basis to declare that flock as a positive flock. You don't want to make the assumption that all cases of mortality in backyard poultry, if highly pathogenic influenza is even in that area, you cannot always assume that every flock is going to be infected with this virus. And so it's very important to have that surveillance capability so that you can identify both the positive farms and the other maybe adjacent farms that may have mortality that may not be related to the influenza. So I think to establish a case definition right up front, very early in the process is a very important thing in developing a control program.
Partnering with your reference laboratories for those countries that have moderate or certainly even poor veterinary infrastructure and cannot do the characterization of these viruses, that's really a key component in figuring out where these viruses potentially came from and help them to understand whether it was a single introduction that spread from a point source or possibly multiple introductions. And that certainly the sequencing and the antigenic analysis and challenge studies, it does require a very high level of biosecurity in laboratories that many countries don't have. And so one of the things I'd recommend is that these countries try to partner in the long term with these laboratories so that they can get the information they need about these isolates. Understand that those reference laboratories also need to be able to release that information either in publications or reports. And so you can't keep them, or you can't try to hide everything, or you can't try to only send out one isolate to try to get all this information that you're going to need to make these decisions. And again, if you do decide to go down the route of looking to see if vaccination is valuable for you, you're going to need this information to make a good decision on what vaccine strain that you should use, what DIVA strategy you might want to employ. So again, that partnering with one of these OFLU laboratories or other laboratories I think is very critical. And again, it should really be done in a long-term process. You really need to try to establish a relationship that's going to benefit both sides over the long term.
What we're all trying to suggest to do a lot of things at the same time while the country has limited resources. I think that while it is important to determine where the disease exists and doesn't exist is encouraging for notification. And I think what we have seen in many of these countries, unless the surveillance activities are associated with the compensation system, with the compensation mechanism, and a good educational campaign that will encourage villagers to turn the cases in, and it will not result in an economic loss to them, we may, again, not get the real picture. And I think that while resources may be scarce, we have been working with institutions such as the World Bank and others to already have in place not only the budget, but the strategy as to how a compensation mechanism would work in a particular country according to culture, according to the prices, etc., so that it does encourage rapid reporting.
In this scenario, there have been some outbreaks in backyard flocks, and certain sectors, perhaps the public sector, the commercial sector, is getting very nervous. These outbreaks are still continuing. Is there a place for vaccination in this scenario? Given that they have limited resources, everything is expensive. Would it be tempting to use vaccination as a less expensive alternative? And what are the pros and cons?
I think there is scope to look at limited or targeted vaccination strategies around stamping out and using modified stamping out with ring vaccination. Now again, the risk you take there is you could then be vaccinating infected birds, which is something you want to try and avoid. But if you have movement controls put on those ring vaccinated areas, that's not such a problem. The problem with that though, of course, is you may spread disease because you've got with your vaccinators, because you're actually vaccinating birds that may be infected. So again, the importance of having very, very good training of your vaccinators to avoid spreading infection from farm to farm. If you know where your flocks are infected, then stamping out alone is quite acceptable, but you will probably get some additional protection in the area around by using vaccination. Chinese authorities have used this strategy with their culling and then a vaccination zone around, which seems to be effective in actually controlling specific outbreaks, and there may be some scope in doing something like that. But again, you have to be careful, because once you get beyond, say, a 1 kilometre zone in an area with fairly high poultry populations, you start getting fairly large numbers of birds to vaccinate. So again, you then run into resource problems with people able to vaccinate the birds.
So would this be kind of like a one-time vaccination as a ring vaccination program, or would you continue it for a certain period of time? What's the exit strategy that one would like to use in this type of approach?
I think in this case you're using it as an emergency vaccination, so you then look after you've done that to what your disease situation was doing in the next 3 to 6 months before you then decide where to go. It may well be that this is a high-risk area and that it's always going to be infected because let's assume this was a wild bird introduction and this was something which was ongoing, then you may look to then use that in the future. But it's a decision you'd make after looking at all the facts, after you've done that vaccination, protect that area, see where other outbreaks occur, and then you make a call as to where you would go from there.
But this would entail a fairly high level of surveillance in that vaccination zone to make sure that there is no continued circulation of virus?
There would be some problems, but you've got to remember that you're not doing surveillance on the rest of the birds either. So other birds outside that area, before they're going to market, are not being tested either. So it's a balancing act. You're trying to get the best you can out of the vaccination, but it's probably not going to be a perfect situation where you're going to know exactly what's happening in every flock of birds. You don't know that already for the other flocks, but you would do what you could to try to monitor what was happening in those vaccinated flocks, yes.
I think to add to that, whenever you talk about the vaccination of backyard flocks, we also have to consider the commercial sector and the risk that they have. And part of that would be probably analysis of how good is the biosecurity, what are the farms like. So for example, if they're commercial farms that are not very biosecure, you may have to include them in the vaccination program, because if there are a large number of birds, they could be a heavy amplifier and contaminator of the environment. However, if the commercial farms have a very high level of biosecurity and they can control the risk by that, then the vaccination may not be necessary for those commercial farms. But it should be probably evaluated company by company, and then probably farm or geographic area by geographic area. Because even within this country, you may have areas where you have more cases than other areas, and you may have areas where you have more density of commercial farms, which may be more of a risk with the high density of poultry.
So if you do a ring vaccination approach, and everyone agrees there's a real need for surveillance after that, is it adequate to leave unvaccinated sentinels because there is limited laboratory capacity, or is it essential to use a DIVA strategy where everything's vaccinated and you use a combination of a marker vaccine and companion diagnostic tests? So are unvaccinated sentinels adequate in this situation?
In this scenario, it said that the authority already decided to eradicate. So I think that they do like ring vaccination around the outbreak case, and then maybe just one shot just to slow down, because the surveillance here is so limited. So it's just to slow down the outbreak, and then you have to stamp out anyway if you want to eradicate. So in this case, if they really want to eradicate and the result of the surveillance still say that it is sporadic cases here and there here. So I think with stamp out, ring vaccination, and then after that the stamp out again.
So all of the vaccinated birds would be stamped out?
Yeah, just to help slow down. Yeah, I think so.
That's a question that I had also, is that if you do the ring vaccination, but you're not sure whether you're going to revaccinate, whether these birds are going to be left alive or whether they're going to be slaughtered, I think in the vaccination campaigns, I think, are more effective when you have a very good plan as to how you're going to proceed, or at least have an A and a B alternative. So, but I think from what you said, if you're going to do that to slow down the spread of the virus and those birds are going to be eliminated anyway, then I think you prevent the concerns I had. Yeah.
An issue that hasn't come out yet is the economics of slaughtering out. You have spoken about compensation, and compensation is an essential factor to go with stamping out to ensure that people do get something for their birds. But unfortunately, it doesn't always cover all the losses associated with the bird, because you're only usually getting the value of the bird and not future production from that bird. And often these people may not be able to restock for 3 or 6 months, and so they've got lost production for a long time. So one of the advantages of using vaccination is that you can actually reduce your consequential losses in those flocks of birds. If you go in and stamping out, you're going to have a high economic cost for that area if you're doing widespread stamping out. And widespread stamping out works. I mean, if you get rid of poultry from an area and you're getting rid of all the birds which you think are infected, it will work. We've had that experience all through Europe in the recent outbreaks, where in Romania and other places where they've done fairly widespread stamping out. In Turkey, same thing. It's worked. So you can do it that way, but it comes at a fairly high cost. And so the question then is, what's your balance? Where do you then say to the farmers, well, we're going to stamp out, we're going to pay compensation, but you're going to have to wear some cost from that? Or do you use an alternative approach where you stamp out, but then you use other options around there which are less socio-economically serious for those farmers?
The first thing that I wanted to point out is that vaccination should never come by itself. So you need to manage a vaccinated area. You need to manage it from a strategic point of view. And for example, you need, together with vaccination, to increase biosecurity. For example, one thing that we did in Italy was to develop small areas that were homogeneous for age. So you have all the chicks going into that area at once, and all those birds come out of that small area, so you don't get trucks coming in and out because birds have to be slaughtered at different ages. And for example, also the area has to be homogeneous for species, so you don't have chickens and turkeys, since they require a different management. So within the management of a vaccination campaign, you need to consider other aspects, which is in fact the territorial management of the poultry industry. Another thing I'd like to comment on is the concept of ring vaccination. Personally, and our experience is that ring vaccination as such, as a concept like we know of it, doesn't really apply to avian influenza, because avian influenza is not airborne, but it's spread by people. And so you can have outbreaks that are quite distant from the first epicenter, simply because it's a truck that's carrying the virus 50 kilometers away. So when you plan a vaccination campaign, you should also consider the functional connections of this industry, and not only the geographical vicinity of the farms, because you can have farms that are close one to another, but they are completely distant from a functional point of view, and therefore infection doesn't spread. And the last thing I wanted to touch is sentinels. Implementing a serological monitoring program which enables a DIVA strategy is by no means an easy thing. It is a lot of hard work. It requires infrastructure, additional testing in the laboratory, and knowledge on how to interpret these tests. And so if the country has limited infrastructure, I don't see why they shouldn't leave unvaccinated sentinels. Of course, you can never be 100% sure that if the sentinels don't die, then you don't have infection, because avian influenza, even the highly pathogenic virus, can have a very long incubation period. But still, I mean, if you have limited resources, you have limited resources, and therefore you do your best and you try to keep the situation under control in this way.
Dr. Vlasov?
There is no one answer to this question. For example, in Russia last year we had several tens of outbreaks, local, very local. It's one village. And we never used ring vaccination and was successful to eradicate all these cases. Why? Because in those regions where the outbreaks was, the distance between settlements was long, more than 10 kilometers in average. In this condition, you need no ring vaccination. You just have to have movement control and good disinfection practice. But maybe absolutely different situation when you have village-to-village distance, for example, if we're talking about backyards, for example, 1 kilometer, 2 kilometers, and very high humidity, no big percent of sunny days and so on. In these conditions, the ring vaccination, I think, will be helpful. And I agree and disagree with Dr. Capua because, for example, human transmission of virus by human, of course, is. But it's easy to control it. If the country not completely pure, it can control it. It's not a big problem. But other thing, if you have in an area, for example, in Netherlands during the last outbreak, the big problem is all of us know that avian influenza is not airborne disease, but in some condition it can be airborne disease. If you have, for example, poorly protected little farm with a ventilation system, through this ventilation system, the dust contaminated by virus will goes to environment and can be spread. If farm-to-farm distance is short, it can spread like airborne disease. And the second one, comment about sentinel birds. If you have good surveillance system, you need know to use sentinel birds. It's obvious. If you have to use sentinel birds, it means that you have no good surveillance system. If you have not good surveillance system, what you will do with those sentinel birds in backyard? It doesn't help. In commercial farms, yes, sentinels is very helpful. What for? For example, to check the quality of disinfection. It's very well working. To check the vaccination flock, big flock. But in the backyards, to use sentinel birds, it's not reasonable, I think.
I think one option is to actually look at any dead birds in that area and to be just monitoring routine dead birds, because that will give you another way of detecting whether there is infection there. Obviously, that's not picking up low-level silent excretion from birds, but it's still a very good indicator for the presence of virus in those vaccinated birds.
Yeah, I was going to follow up. I think also that targeted surveillance of looking at the dead birds is very important. And I think that's an effective strategy even in vaccinated birds, because even in a vaccinated flock, you will not have 100% immunization of those birds. And so typically 2 to 5% of the birds will not be vaccinated and will be naive. So even in vaccinated birds, if you're targeting your surveillance to your dead birds, in chickens, you're likely going to pick up the virus very easily if you have an adequate surveillance system. And that is, I'm talking about using diagnostic tests like virus isolation or RT-PCR to make that diagnosis. The difficulty, of course, is when you have ducks or other species that don't oftentimes will have severe clinical disease symptoms, you may not pick it up with that sort of targeted approach. And so you're going to have to look at that population of birds and use more of the standard surveillance where you're actually going out and testing a certain number of birds to get your prevalence of infection, or at least your confidence interval for what the prevalence of infection might be.
One of the issues I think we've had some discussions on is maybe some definition issues, and one is ring vaccination. I think sometimes different people at the tables are talking about different things when they talk about ring vaccination. And my thrust on it would be that really what we're talking about is in an area that we might define geographically as you want to do vaccination in that geographic area. but within that geographic area you probably decide, depending on the risk of individual compartments, which ones would you need to do the vaccination in. And you would have to, outside that region or that zone that you call your vaccination zone, you would have to do surveillance outside that to compensate for the possibility of infected birds going from your vaccinated zone out into a supposed free zone. You'd have to be watching for that, and that would just require that surveillance around the outside edge of your vaccination area.
But then perhaps what is called ring vaccination is an emergency vaccination. It's not necessarily a ring.
Right.
So it is a vaccination program you decide to put in place because you have a problem. But then I would call it emergency vaccination. And just topping up on what you said, what we did in Italy was we identified an area that was at high risk, but we only vaccinated the birds that we thought were more at risk of infection. So if you decide to vaccinate, you don't necessarily, in a given area, you don't necessarily have to vaccinate everything. You can decide to vaccinate certain species, you can decide to vaccinate certain compartments, you can, for example, decide to couple with vaccination an increased surveillance in birds that are not vaccinated in the vaccination area and outside the vaccination area. So it has to be, the emergency vaccination program has to be developed, as we said, on a country-by-country basis, identifying the compartments that are more at risk and intervening on those. And if you see that it's not working very well, then you have to be flexible enough to say, okay, we've made a mistake, and we should vaccinate this other category as well.
I saw one problem about ring vaccination against avian influenza, because if you want to ring vaccination, you have to figure out like how many kilo radius you want to ring. You need to ring. This is depend on the rate of spreading of the virus. And then you have to calculate, because if vaccinated, antibody is not happen right away. It needs some days to develop enough to protect. Then in some country, they may be limited by law. For example, my country, you can control only 5 kilometers. We just change to 10 kilometers to comply with. In Japan, they may be like 30 kilometers. It depends. So you want to ring, you need to know how much area you need to ring for how many days. And so the other thing that can help that is, again, emphasize on movement of vehicle, animals, everything, and disinfectant. Disinfectant will help in this situation as well.
If we're focusing on vaccination, it's only going to work to the extent that we incorporate and apply properly the other tools. And I think, like you suggested, different surveillance programs inside and outside the vaccination area. To what extent, can you control the movement of people and vehicles? To what extent do you have the legal authority to apply some of these? So it goes back to what we said earlier, is that it is a very useful tool, but it's only as effective as it's used in combination of all of the other ones and not in replacement of.
Jim, I'd just like to pick up a few comments on eradication. I have no problem with this country's desire to eradicate the virus, but two aspects to that. One is, if you're eradicating and then don't have the capacity to demonstrate that you have eradicated, then, which we have in many countries at the moment who have gone through the process of eradication, but we don't really know what their status is, and this is a difficult situation. The other thing is that our experience with eradication in many countries with H5N1 in Asia is that since 2003, there have been a number of countries have eradicated the disease for a period of time, but they've then got reinfected. And this is another thing where we need to work out, where is this virus coming from? What can you do to consolidate on your gains once you do eradicate, and to ensure that we do more than just eradicate and then stop, because you will get reinfection happening. I mean, Russia's got the situation where you've had 2 years now with virus coming back. We've had the situation with South Korea and Japan having reinfection 3 years later. The only place in Asia which hasn't had a reinfection in poultry after stamping out was Hong Kong, and that's used a whole comprehensive set of measures, including vaccination, to do it.
We're now ready to discuss a new scenario, which is a country that has very limited resources. This hypothetical country has almost all backyard poultry, and the H5N1 is endemic in the country, in the backyard flocks, which consist of both chickens and ducks, in the waterfowl, and is endemic in neighboring countries. Many human infections have occurred. Poultry is not exported from this country, but it is a main protein source for the people. The veterinary infrastructure, the diagnostic, surveillance capabilities, and the financial resources of the government are very limited in this scenario. The goal of eradication of avian influenza H5N1 from the country does not seem possible under the current conditions. And our panel will now discuss where to focus the limited resources to help ameliorate this situation.
Well, obviously, this is a much more difficult scenario than the previous one that we had discussed. And so there's certainly going to be lots more issues that have to be addressed before this country can start actively controlling the disease that's there. I think, for me, the first thing that probably has to occur is that the country needs to be as transparent as possible, and they need to try to get outside assistance as well from both international organizations to try to get additional resources into the country so that they can start getting the tools that they need to start fighting this infection. We also, I think, need to have coordination of both the human and the veterinary officials. So there has to be a very high level of government support for these projects and an understanding that because the human infections are occurring, both human and veterinary officials have to be closely linked and decisions have to be made together. So this is really a situation where communication is really of paramount importance. I think the education also needs to be an important campaign, certainly to educate the population, certainly educate the officials and the government about avian influenza, if possible, to include biosecurity and food security, to try to eliminate practices of trying to eat poultry that have died from infection. Now, vaccination, which is certainly, I guess, the issues that we'd wanted to talk about here, I think we have to at least give that some consideration. But again, that's probably going to be a long-term issue or response, and it's not something that can be done in the short term. So we can think about vaccination, but again, a lot of other things have to be put into place before we can actually implement vaccination as even a potential for a control program.
I would agree with what you've already said, Dr. Suarez, but I think the primary goal here, since there are a number of human infections, is to reduce those infections in humans. And probably in the short term, vaccination is probably going to be one of the best options to do that, because the public will not stand for anything less. So the long-term goals are going to be very different and going to be very challenging, but I think you have to immediately look at the short term to try to and prevent the infections that are occurring in humans.
I would like to support what Dennis Senne just said. The main problem of this country appears to be, of course, the human infections, which is a problem for the country itself, but is a problem for the pandemic threat of this virus. And also the food security. We are talking about a country that has very limited financial resources, and therefore, as avian influenza is a disease that kills birds, the protein availability for that given population will be reduced. And therefore, perhaps a suggestion for this country would be, of course, to seek external advice and to seek external support, but to suggest the use of extensive vaccination, for similarly to what was done in Vietnam, to protect both the protein source for humans and to reduce the human health implications of this disease. Because we all also know that the more the virus infects humans, the more it adapts to humans, and therefore the more dangerous it can become for the whole of mankind.
Unfortunately, I think that the country, from our scenario itself, can do nothing. But in this scenario, we did not say about a very important thing. Is it big country or is it small country? If a big country, it's not very important are neighboring country endemics or not. If a small country, if this is a small country, the first that need to be done, the efforts have to be touched on any kind of unification of regional. Because if country is small and the disease is endemic in this country and neighboring countries, they have to fight against this threat together, or the fight will be unsuccessful at first. Then very important in which zone this country is regarding birds migrating. If this place of wintering of birds, the threat will be continuous. If this country in northern part of the world, it's only will be waves of infection. It's very different situation. And I think that this country have to begin from international cooperation between this country and neighboring country at first, then from the cooperation with international organization, because this country cannot win without support from outside. And third that he have to, from which they have to start, and to find a man or several men who is very good specialists in this organization of measures and involve them, because in very pure country it's highly improbable to find the specialists of this class. And then the same scenario like in first scenario, because with the help of international organization, resources will not be so limited.
I think the country can do something. And even if the resources are poor, initially, what I think is one of the critical elements is education, the communication of a very clear and simple message as to how they can minimize the human exposure. Quite often, they're related to traditional practices of very close association, not too much so in eating the product, but in handling, the dead birds, the sick birds. So, and I don't think that has such a high cost, is to deliver a very simple message adapted to those conditions, whether they're pamphlets in the language, and quite often they're even just symbolic without words, to educate the public as quickly as possible. On the one hand, to minimize the human exposure, and on the other one, to try to encourage the prevention of movement of birds and products that would further spread the disease. And as to transparency, and I agree with David Suarez, unfortunately, I think the incentive for reporting is only going to be associated with a way of minimizing the losses to the affected people. So going back to what we said earlier, compensation and others. Otherwise, I think we're going to continue to see the illegal movement of trying to hide the problem because of the direct losses to the affected people.
Following what Dr. Capua said is that the vaccination program may have a lot of utility here. Of course, on the last scenario, Les Sims had brought up the issue of resources, and the usage of a vaccination program is going to highly be dependent upon the resources that are available. And within those resources, you'll have to have an assessment of where the highest risk is in that country. If it's a small country, maybe you'll do the whole country. If it's a large country, you may have to identify where the highest risk of infections are and then do heavy vaccination in those areas. A couple of things about the vaccination will be critical. For example, the government's going to have to control the vaccine that comes in and have a high assurance that the quality is going to be very good, that it's going to meet international standards for OIE and FAO to be a high-quality vaccine that's going to be very efficacious. There's got to be well-trained vaccinators and good logistic programs to have assurance that the vaccine is going to get to the birds at risk it's going to be properly administered, and the vaccination program is going to have to be ongoing for a period of time. So it's not like an emergency vaccination program that Dr. Capua had mentioned earlier. It's going to be more of an ongoing vaccination program. We would have to continually vaccinate naive birds within that population to get the immunity up and reduce the virus replication, contamination, environment, and spreading. And finally, when that vaccination is used in those countries, there would have to be ongoing reassessment of the field viruses to the assurance that the vaccine is going to continue to protect for many years. And after 2 or 3 years of vaccine use, those challenge studies need to be repeated to assure the country that the vaccine is being effective at preventing or at least reducing the infection rate.
And this just comment from David Swayne brings us back to the issue of accrediting control programs. Because in an ideal world, I believe it would be very important to have listed vaccines that have been tested and that have been recognized by the international scientific community as vaccines that are efficacious and that are suitable to be used under different circumstances. And also, of course, since implementing and managing a vaccination campaign is difficult, is full of traps, is uphill. I believe that if information on prior experiences could be made available, the countries that don't have enough resources could use the programs developed by other countries, could use for example, the sanitizing programs that have been developed under different situations, perhaps in the same climatic environment, and therefore we could maximize the outcome of everybody's effort in this way.
I think we have a few opportunities here with the human infections, because human infections are often our best indicator of where avian disease is. Unfortunately, we have the situation where humans are acting as sentinels for poultry disease, which is a very sad state of affairs, but reflects the limited surveillance capacity we have in a number of countries at the moment. But if your human cases are occurring in restricted regions, then you could then look at trying to focus your vaccination campaign to those areas where you're getting most of the human cases. And perhaps you'd look at your population of birds which you believe to be your highest risk, which in this case would almost certainly be your duck population. If you can control the virus in the duck, you may then be able to control the spread from there to other poultry. But I think David's point is very, 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 very important. Resources are critical. If you try to organise a vaccination campaign without having the resources to actually deliver that vaccine, it's going to fail.
In this scenario, I think the vaccination is a long term. In the long run, you may have to use the prophylaxis vaccination, like suppressive vaccine. But here, this country already has many human cases. So in this case, I think we have to think about human first. And then, just like Dr. Thiermann said, we have to raise public awareness, food safety, and traditional to improve the security of the practice as well. And I couldn't agree more with Dr. Capua that this country is a country really in need for international assistance, because this is where the pandemic strain may occur, and pandemic is a global threat. So they cannot surveillance by themselves, and then if pandemic subtype occur, who's gonna know? So that's gonna need help from international community.
I just want to restate a little bit what I talked about. It's not, I think, and it seems like there's general agreement here that vaccination can be an appropriate tool for this country. So my question is not if we should vaccinate, it's when. And so if we try to start a vaccination program without having at least enough veterinary infrastructure so that we can maintain the cold chain of the vaccine, so that we can have, again, the proper vaccination protocols, that we can monitor the effectiveness of the vaccination, you know, we're not going to be able to really say if vaccination is going to be of value in that situation if it is not done at least to some minimum standards. You know, Ilaria had also talked about, you know, the vaccines, that we certainly need to have vaccines of high quality to be able to use in the field. But we certainly are seeing now that there is so much variation of H5N1, we really need to know what clade it's in, and even within which clade, maybe which subclade, to try to identify which vaccines are going to provide us the best protection. So again, we can have vaccines that may be able to prevent clinical disease but doesn't prevent large amounts of clinical shedding, and then that's not going to get us closer to reducing the amount of human infections that we're likely to see in this situation. So again, it's not if, but when, what is the best timing that we should use vaccination, and that's my concern about getting in international resources and improving the veterinary and human health infrastructure so that we can do a better job of implementing the vaccination program.
You give me an idea when you mentioned the issue of the risk of the pandemic strain here. I think that rather than looking at the country for a minute, we could look at ourselves, so look at the international community. And indeed, if the international community is that worried about the pandemic potential, and resources have been identified in these various meetings, in my opinion, we have been slow in mobilizing those resources where the highest risk is and where we can have the biggest impact. Too much of the focus has been in protecting the human, and very slow in mobilizing resources quickly enough to a country like this, where we may have the quickest impact in reducing the human exposure and therefore addressing the concern that the developed world has about the pandemic.
How do the international organizations and community, how does the international community speed that process to get the aid there more quickly?
What we have heard is that funds have been identified by the major donors, meetings have taken place to identify what are the needs on the human side, on the animal side, but there's still a very long lag period from the time the pledge is made to the moment that the resources are made available and before the resources come to that country. I think on the one hand, we need to prepare the country to receive those resources, because it's not just money that will fix the problem. But if we look at Southeast Asia, and I ask the question, if the resources would have been placed in Vietnam in 93, 94, to the degree that they needed it, would the Asia picture look like it does today? And I think, and I will speak on my own here, but I think that we have not done a good job, the international community, in really putting the resources on poultry where really we can have the biggest effect on reducing the problem.
There is one major issue with international support, and that is it's very hard to get manpower as part of a package for international support. You can train people, but you find often you're training the same people again and again, and there's just not that manpower in these countries to train. And it's an issue that we need to look at critically to overcome, because until you actually get the additional bodies to do the work and look after those people and pay them appropriate wages, it's very difficult to actually implement these programs properly.
Then often you see that the funds are there, but the funds are only given when a really strategic plan is prepared. And that's something the countries can't do. They are not able to make these plans, and therefore the money is not coming in. So that's another point where we have to support them to get these real plans, to get a strategic control program done. Also, sometimes the international community doesn't want to give the money because they don't feel that there is commitment really to control avian influenza. Well, for these countries, sometimes avian influenza is not that a problem. Even if there would be, say, 70 deaths, probably many more people in those countries die of other diseases. So for them, it is not a major problem. It is the major problem for us because we fear the pandemic. And so if we want, as an international community, have the control of avian influenza, we really should give them the resources. If we talk about vaccination in a big country with a lot of endemic infected poultry, then they need probably high amounts of vaccines, not only to be able to vaccinate them once, but to vaccinate them twice. And that's asking for money, and they don't have the money to buy the vaccines. I don't think the vaccines are really the problem. I have visited some, and we, as the Netherlands, have visited some vaccination plants in those countries, and those are not very bad. So it is not only the vaccines that should be produced elsewhere, and that these countries can't produce the vaccine. It's more the way to apply the vaccine in the field where it's going wrong. They don't have the surveillance systems, they don't have the veterinarians to control it, they don't have the legislation to enforce everything what is needed. The biosecurity measures, the standstill, everything is failing, so we are in a vicious circle, and that's a major problem.
Following up what Koch said, one of the comments was about the surveillance. That's going to be critical, because once you begin implementing a vaccination program, you're going to greatly reduce the number of clinical outbreaks. And if the country has been using clinical signalment of high mortality as a trigger for investigation to say this is a high path AI, after the vaccination begins, you will lose that trigger. You'll lose that clinical ability to identify those cases. And so that the surveillance is going to be much more difficult. It could be, as Dr. Sims has suggested earlier, is doing dead bird mortality testing. So within that geographic area, within that village, using dead birds that would be picked up on a routine basis and testing them would give you a handle on how successful that vaccination program is being at suppressing the infection, and then at the same time, hopefully the human cases would disappear from that area. But it's not going to be easy because of the logistics of the veterinary system in that country would have to be enhanced to be able to collect those samples, send them to a laboratory, process them, and get that information back to the decision makers.
I think a country like this, maybe the collaboration in that region maybe come into a role. Like you can, as a address to Dr. Roth's questions, like how can you mobilize resource quick enough? Okay, you can sometimes we use like regional expert from neighboring country, just move there, and because they're familiar with maybe agriculture system and kind of speak similar language, something, so they can help in this case. They can help for training or even do the simple surveillance and take sample back to the lab in the country and do. Yeah.
My comments will not be exactly about this scenario. I would like to say that our world becomes smaller and smaller. The people in the world, the amount of people, bigger and bigger. And now we're faced with a situation that very soon can be typical, because the ecology of the planet is in bad condition now. But international organization, I think they have to think about the situation in advance and just try to think what can be if international organization, I mean OIE, FAO, will build any system of emergency teams that can be sent to any country in a threat of pandemic. Similar, like, for example, forces of United Nations that can be sent in any conflict area in the world. It's first, and the second. We're talking about organization of measures. But international organizations, I think, have to think in advance also about the tools, maybe new tools, how to fight with the pandemics, how to fight with this threat. I think that a very good idea should to create the vaccine can be used on wild birds, for example. As far as I know, no one organization put this task for World Scientific Society. I think this approach could be very helpful in future, especially.
I was just thinking, and I had visited some of the Southeast Asian countries on this, and saying, how do we make it their problem or understand it in the terms of the other problems that they have, and to identify benefits to that country as well. Because let's face it, quite often we come in and it looks like it is a concern of the developed world because this could become a pandemic. But the solutions sometimes are very narrowly focused on today, on avian influenza, rather than on how that country could be better off once the problem is done. So look at more midterm solutions and obtain the buy-in. Quite often we see great differences of opinion between the Ministry of Agriculture or the Veterinary Services and other sectors in government, other ministries, or even the president of the country itself. So at the local level, to work on the compensation aspect to get the transparency in the participation on the part of the peasants, but convince the government of the more long-term benefits once we are over this crisis, as to the benefits nationally and internationally of enhancing the infrastructure of the veterinary services. For example, in one of the Southeast Asian countries, when I was mentioning the potential risk to human health because of avian influenza, they said that yearly they have 18,000 deaths due to rabies. So you have to put it in the context of their situation rather than the global concern of a human pandemic.
One of the things which I'm pleased to see is that if avian influenza has had one silver lining to a very dark cloud, it is that we have been able to put some more money into veterinary services, which has been long overdue. And I think that's been one of the key features of most of the programs which have been developed, has been to put more money into the veterinary infrastructure in countries. Now again, there's a limit to how much you can do, but I see huge improvements just in the 2 or 3 years we've had in terms of the capacity of the people in these organisations and in the resources they have at their disposal. There's still a long, long way to go, but I am seeing some good signs that we're getting somewhere with the improvements in the veterinary services and with the LIE program to actually give some sort of standard or audits and levels that they should be achieving. That again provides the donors with ideas of where they should be heading. So I am seeing some positives there. A very quick comment on communication, if I can. Again, we have to use communication, but I think we have to be also careful about expecting too much of communication campaigns in behaviour change. And there have been a few papers recently looking at what has been the impact of the communication campaigns for avian influenza. And quite frankly, behaviours are still fairly much as they were before, despite the fact there have been quite extensive communication campaigns saying these are the do's and don'ts for avian influenza. And it comes down often to poverty and people's needs. And if the need is too great, then the message gets lost.
I wanted to just return to our poor country. And I think that there is general consensus around this table that certainly in a country that doesn't have the capacity to react to such a problem and does not have the veterinary infrastructure to intervene rapidly, vaccination could be a way forward, and particularly if you have human cases, would be a recommended way forward. But it's a pity that around this table we don't have anybody from the industry, because one of the biggest problems I see and I understand from having been involved with avian influenza vaccination over the past years is that companies don't have great amounts of vaccine available. And therefore, my open question here is, should we not recommend that maybe the international organizations that we are, in inverted commas, criticizing because we say that they haven't reacted fast enough and they weren't there fast enough, maybe one thing they could do is acquire some stocks of vaccine that can be sent out, delivered to the countries that need it, since these countries could never buy it and could never afford it. And therefore, if we identify in a given part of the world a particular area that could really represent a big problem for the well-being of the people and for, of course, the food safety, the food security issues that avian influenza has, but also for the pandemic potential, then wouldn't it be the case to have some stocks available that can be sent out? I realize that people need to know how to vaccinate. They need to know a lot of things about vaccination, but still we need to start from somewhere.
I'd like to add there, I think Ilaria raised a very good point, and I may add that the OIE has been working on that, and what we're looking at is vaccine banks. And currently we have one established for the region of Africa. And so there was close negotiation and collaboration with the vaccine manufacturers and have a tendering process, at least for them to identify the stock and be able to commit themselves for a quick delivery. And the rapid distribution of that obviously has to be in line with the other decisions at the country level. We cannot just come in with the vaccine prior to the other places being. But we have seen cases where the delivery of the vaccine has been the delaying factor. And we have worked at the regional level in Africa to also identify what are the terms of reference for the distribution, for restocking, for payment, who is going to pay. But some of the bigger donors are quite interested in participating that way so that we could have, at least at the regional level, the vaccines available.
I think this also comes back to the issues of transparency that the countries, I know, oftentimes feel that they don't want to report when they have suspected cases of outbreaks. They don't want to send samples out because they are concerned about the economic impact that it has when it is diagnosed in their country. And I think that it's going to be difficult to kind of change that mindset to get that transparency, that they can actually gain more by being transparent than they're going to lose economically. So if they get support in quite rapidly, they can be better off in the long run, or basically minimize their losses by doing that. As was mentioned by Les earlier, we've had the case where humans really have been the sentinels for H5N1. Some of those cases, I think, were clearly that the veterinary infrastructure was so poor that they did not recognize that they had H5N1. But other cases, I believe it was the veterinary infrastructure knew what they had and were not allowed to report it because of political concerns, again, about reporting and about allowing viruses out of the country. And we're certainly still seeing that problem, is that countries are withholding viruses, sending it to international laboratories. So we don't even have a clear idea of what is out there. And again, if we're going to have a vaccine bank, we need to know what vaccines we should stock based on what is the prevalent strains of viruses out in the world today.
Can I just raise the question of what we mean by endemic? Because I think this is we throw this term around a lot, but I think there's very few places which are endemic like this. I think we're getting a lot of seasonal troughs and peaks, and there may well be some countries where virus actually does disappear, especially countries which have got low populations of ducks, warm climatic conditions, and just generally low poultry density. And I think some of the countries we deal with have probably been free from infection temporarily, and then were reinfected. So it's just a point on the use of the word endemic. And I know what we mean. I think we all know what we mean. But I think it covers a multitude of disease situations.
Jim, and if we're close to the end of this, I think what I would like to make a statement is that by strengthening the veterinary infrastructures in these countries and help them with early detection and rapid response, we're going to be better prepared to face another emerging disease. And it's quite possible that the next pandemic may not be avian influenza, but maybe a disease we still don't even know, and we will not know where it shows up. So the entire world is going to be better off by helping the countries having an earlier detection and response mechanism throughout the world.
I'd like to come back on the providing these countries with vaccines. That's of course a short-term solution. We should be aware, and we should be willing to support them on a long term, because if no other measures are taken, if the veterinary structure is not enforced in the short time, then at the long time you have to vaccinate them, you have to restock them with vaccines. So this may be a continuous program in which we continuously have to shift money to these countries.
Really, as the vaccination program is instituted, it should be reevaluated and reassessed, and the program should be readjusted with an idea of an end in mind. So initially you begin with, say, a blanket vaccination program to get the infection rate down, to reduce the human infections, the animal transmissions. But then as you do that and achieve that, then you have to figure out how to eliminate that vaccination and fully eradicate that virus.
But do you realistically expect we can eradicate this virus?
Not in the short term, no.
Even the medium term?
Probably long term. But historically there is there is suggestions that fowl plague has been endemic, or at least has been persistent in some environments in the turn of the last century, and that appears to have been eradicated. The question today is, can that be repeated under the current conditions?
I think you're more optimistic than I am.
But David, it wasn't, eradicated, it disappeared.
Disappeared, that's correct.
So it's not that human beings influenced the eradication. It's that it disappeared, also because the poultry rearing at the turn of the century, not of the last century, of the century before, was completely different. So certainly in some places of the world it could, and I hope it will be self-limiting, but there are, the trade of poultry and poultry products across borders is a very important factor, which is much more developed now than what it used to be. So I think that, I try to be optimistic, but it's certainly not an easy challenge.
I don't think that the situation is a hopeless situation. I think there are tools out there. I think that if we have changes, especially industrialization of many of these countries, that will change the country by providing more funding for better infrastructure. It will change the agricultural systems and all those things together. That I think the goal is achievable in the long term for eradication.
Yeah, that's long term, and I think you're right about this change in the industry. I mean, that's something which will happen over time with economic development. We just have to look at countries like Thailand and how Thailand's changed with its poultry industry over the years, and I think we'll see similar things with other countries, but it's not something that's going to happen the next 10 or 20 years. It's a long-term thing.
I think we also have to be cognizant that this H5N1 virus is doing things that we haven't seen high-path avian influenza do before, specifically that it has gotten into wild birds and seems to be being maintained in that wild bird population. So I think the question really at this point is unknown. I'm optimistic that we can primarily eradicate it out of our commercial poultry, but if it maintains itself in the wild bird population, then again we're always going to be at risk for reintroduction. And so that's the thing that we don't know yet. Will it be maintained in that wild bird population where we haven't seen high-path AI being maintained before? And so I guess the question to me is still very much up in the air.
I just wanted to ask you a question which might be a little bit difficult to answer, but you say, of course, H5N1 is being maintained in the wild bird population. Are we sure that it is being maintained, or has it spilled over? And of course, having spilled over, it takes a while before the wild bird population can make itself free, let's say. Because it is my impression that the situation of the past winter is completely different from the situation of this winter. It could be due to many different things, including the climate, because it has been very warm, at least in Central and Southern Europe until a few days ago. But I don't know if we can say at this stage that H5N1 is maintained in the wild bird population. I don't know if you have any...
Well, I can certainly comment on that. You're right that the evidence is not clear that it is being cycled in wild birds and it is not going through any commercial poultry or poultry as part of the maintenance cycle. That part is not clear. I think the evidence has been increasing that it is in wild birds and that there have been wild bird surveillance in regions that are remote from where commercial poultry is, and they can isolate H5N1 at a low rate, but that they can still isolate high-path avian influenza. I'm hopeful that it will not be maintained in the wild bird population, but again, we've seen this virus do things that we haven't seen other high-path AI viruses to do, so it's very difficult to predict whether it will or will not be maintained in that population.
Well, sorry, can I just finish? Would you not agree that the wild bird situation now is less worrying than what it was a year ago?
No.
I would like to add just a few cents on that one as well. I think that while we do have some evidence that wildlife has played a role, at least in some parts of the world, in following up a little bit on what Dr. Capua said, the scenario is also possible that if we were to leave the wild birds alone, it would eventually disappear. And if we don't do the right thing in domestic poultry, it is possible that the domestic poultry continues to restock or refeed the virus into the wild population that would have done away with it by itself. So therefore, again, I think the focus is we have to do the right things on poultry, not only because of the pandemic threat, not only because of the human exposure, but because we may be also responsible for reinfecting wildlife.
To add, I agree with Ilaria that there is really no evidence that it is maintained in wild birds, really. If you look through Europe, it is introduced here, but it didn't stay in the birds. It didn't infected birds which migrated in Europe to the north, but until now it didn't come back with those birds, which to me suggests that it is not maintained, at least not in European migratory birds. So I'm convinced that the fact that it is in migratory birds in Asia is because there is still a big spillover of the virus from poultry to migratory birds. And probably there is more spillover to the migratory birds than the reverse, that migratory birds infect poultry.
Also, the African birds, our lab has tested thousands of samples from African birds, wild birds. And I am confident that there's a lot of virus that has circulated in Africa, certainly in the first semester of 2006, and we have not found any wild bird positive, either local wild bird positive or wild birds that migrate from Africa to Europe. So I don't know, I have the impression that, as Gus said, in Asia there are certain characteristics which make sure that this spillover is continuous. But I wouldn't be so sure about saying that we have a truly endemic cycle in the wild bird population that can be perpetuated forever.
I really like the terms virus spillover because I really think that it's spillover. And in this second scenario, it can spill over to other species as well. Who knows? See, this one can go to the pig, cat, tigers, who knows? So really, this country need the international organization to help them.
I would like to stress that usually we're talking about the migration pathways, like about the separate pathways. When we're talking about African birds, for example, we have to remember that there are no African birds. It's united system of circulation. If we see now, for example, this H5N1 virus in Americas, for example, it's just the same like if we had the waves going from the center of cattle, the waves will not be in the borders immediately. We need a time. But it's a single system.
Again, I'd probably differ on the view whether we have an independent cycle. I believe we probably have an independent or semi-independent cycle of infection in birds. I think the molecular evidence suggests we probably do have some independent cycling happening, especially coming out of the northern parts of Asia and down through that area. But I think time will tell on that as to whether that's really the case. But it doesn't alter the fact that we will not probably remove this semi-independent cycle where you get, if you are getting cycling from poultry to birds, because we're not going to control this disease in the smallholder and backyard poultry population in the next few years anyway. That's not going to happen immediately. There's a lot of work has to be done. We will keep that down to a low level or a lower level than we have now, but it's not going to go away. And so I think we're going to have to put up with this semi-independent cycle, if it is a spillover situation, for some time to come. And that will give us time to see what's happening.
I want to thank the panel for their willingness to address these very difficult scenarios. And I think we've all agreed that there are enormous challenges and a lot of unknowns about the present and even more unknowns about the future. This group is a set of international experts who've been working on this problem for quite some time. I think we also agree that the international community of both the veterinary and human health community all need to work together to try and resolve this situation. Thank you very much.